My name is Dr. Levit. I'm a dermatologist and a cosmetic surgeon, and I have the honor of having
Sarah Vidal. Hi, I'm a student.
She's a medical student, and we're going to share with you a secret. The secret of how to get this perfect appearance of the marionette lines. What are the marionette lines? The marionette lines are those areas that make you look hungry, not hungry, but angry and sad. And it is something that the patients often come to me and tell me, I look in the mirror and the person looking back at me is not me. It's a sad person. It's an older person. And why does it happen? So to understand how to improve and get the results, this beautiful, amazing results that you see in the image right here below, in this lovely lady, I'll explain to you the secret on how to get it. First of all, let me explain to you a little bit the anatomy on this beautiful gentleman sitting over here. So these are the marionette lines. They're kind of coming from the puppets. They have like this scarred area that they use in order to open and close their mouth. The marionette lines obviously are not seen when you're young, as Sarah is, and you can look at her. She don't smile first. She's just very happy to be with you guys and share the secrets. So you don't see those lines. Why don't you see those lines? And you see those lines in the lady in the image. And in me, I've done something so you can't see them too well. I'll explain to you what I did to myself. So the reason you don't see it is because the cheek is having very good support by the maxillary bone, which with age starts resorbing. You can see it in me. I did some sculpture and fillers to help augment the cheekbones here. And also because the muscles that are lifting the zygomaticus minor and major muscles are supporting the corners of the mouth. With time, there is more weight on them because the bone is lost. The skin that was supported by this nice projection of the zygomatic arch and the maxillary bone loses that support, and so it starts hanging down on the area. Add to that, there is a muscle here, a very strong muscle, which is a depressor muscle. It pulls it down. Why? It kind of looks like you're depressed. And I'll show you here on this gentleman. This is the modiolus. It's a fibrous connection tissue where multiple muscles are inserted into that area. This muscle over here is the depressor anguli oris. As Dr. Kotofana, who was kind enough to be part of the book that I published on cosmetic surgery, very well reported on, most of that muscle is found, about 70% is found lateral to the fold, to this marionette fold. So what you want to do is you want to inject a little bit Botox to weaken that muscle, therefore allowing the rest of the muscles to have less resistance from gravity and from this muscle. I'm pulling it down. You can see the platysmal muscle insert into the facial muscles, and the depressor anguli oris muscle, which originates from the bone and inserts into this modiolus, pulls very, very powerfully down. The rest of the muscle is supposed to pull it up. So if you weaken it a little bit, then you give a little bit extra support to that area over here. You can allow the rest of the muscle to have less tension on them, and so the angles will lift and you get this nice result. The other trick, what you want to do, and again, it depends on the amount of looseness of the skin that you have, is to give it some support to allow this to project out again. It's similar to what people have after they deliver their children. Very often you have the empty sac syndrome, and thank God you don't need to think about it for a while, but it's something that we all eventually will have. I'm working very hard on trying to improve that, so wait to see how we're doing that. But the problem is, once this is not supported, the breasts start hanging, and so does the skin on the face starts hanging. And the best way to do it is to use some biostimulators, either Radius or Sculptra, or as a matter of fact, you can use any filler. I like to also use exosomes, extracellular vesicles with some growth factors, specifically mesenchymal stem cell derived, to allow the area to stimulate your natural bone, fat, muscle, to rejuvenate it and to give back that beautiful projection that gives this youthful look. So if you look at the way people even use their shadows, they will accentuate that area and they'll use a little shadow below to separate it and to give this beautiful angular appearance, allowing the light to reflect off it. When you lose that a little bit, that will droop down. That's what gravity does. It pulls everything down, and then you'll start developing that skin hanging on top of that insertion point, because it cannot droop further down. The other thing that you also have with time is you have the jowls, and thank God she doesn't have the jowls. I have it a little bit over here, you can see, especially if I go like that. The jowls are also a result of loss of the support structure. What happens with time, and I have put a little bit filler for myself in the mirror, I inject myself, but what happens with time is you lose the projection of the mandible. She has a very beautiful projection of the mandible. She's young, she's very proportional, but if you lose a little bit here and you lose a little bit of the bone support here, this kind of starts collecting, and as the skin slides, it has some areas to which it's tethered. It's kind of like the pants. My pants are tethered somewhere, and so if I put my shirt this way, it will hang over that tethered area. And the same thing here, there are some ligaments that are supporting the area and they prevent the skin from hanging below that. But above that, they hang and they start folding down, and then you get this type of jowl. Way to improve it is you can put a little filler here, you can put a little filler back in there, and a little filler in the gonion, we call it, which is in the angle right there of the jawline. Hopefully this was educational and helpful to you guys. A lot of information. To see the results, just look at the picture. But to see the technique, you can follow us on YouTube. And if you have any more questions, please send us a DM and like us on our YouTube channel. And as we say at Levit Dermatology, health and beauty is our duty. Be good, do good, say good, and may good come your way. God bless. Thank you.